Glad to know you're still right there with us. If you're just tuning in, this is Real Talk with Kike, and we are with our Honorable Minister. He is on the show informing us about the plans of the government in getting the COVID-19 vaccine and how well the federal government is trying to ensure that pandemics and epidemics, including the Lassa Fever, are under control. Thanks for hanging on the line, Honorable Minister. Absolutely a pleasure having you on set today.
Right, you're welcome.
Yeah. Please join us by calling our phone line 0700 923 923 923. Or you can send us a message on our WhatsApp line 0817 313 6193. Let's hear your perspective of the topic at hand. And of course, you have all the time to ask us all the queries, all the questions, all your comments during our time belt. So, sir, few days ago, you disclosed that we are currently having 1,131 cases of Lassa fever in no fewer than 27 states of the country. I hope I'm correct. I stand to be corrected. What is the level of the severity of this pandemic that we are dealing with, and how well is the Ministry of Health handling this pandemic or this epidemic?
Well, what we know is that you have periods of outbreaks like this.
Okay.
For the Lassa fever, and we have sent out our people from the Ministry of Health who are experts in looking at the situation in various states and giving us reports. But having said that, we also do know that even the primary agency, which is NCDC, Nigeria Center for Disease Control, is also doing its own bit, which is to liaise with the various states where outbreaks have been recorded, and then advise the state government and the relevant officials of the respective states as to what to do. Lassa fever is a very deadly disease. And of course, the case fatality ratio is very high, running to about 16 to 17%. Yeah. So that is very, very high. That is why we cannot afford to joke with Lassa fever. But having said that, the most important thing by way of what is expected of our people is the environmental sanitation, and then education, health education. People must know that this is a disease that is transmitted by rodents, and through their feces, through their urine and all that. So it's important for people to know that they need to take care of themselves and not exposing their food items to where rodents can have access to them, and to the extent of now urinating or passing fecal matter on these food items. So that's very, very important. So that's why we need to increase that education regarding how they can keep safe and prevent themselves from catching Lassa fever.
All right.
Yes.
All right. It is good to know we have a proactive Center of Control of Disease and Pandemics in synergy with the Ministry of Health. And of course, you've updated us regarding the NCDC in combating the epidemics in the peculiarity of our country at the moment. But sir, speaking of the capacity of our healthcare system, the healthcare workers are fundamental in fundamental in delivery of healthcare services. And we have seen in recent times the striking of healthcare workers in the country. What is the plan of the government to enhance the welfare and the capacity of our healthcare workers in the country?
Well, I can tell you that the present administration under President Muhammadu Buhari is giving the health sector a lot of attention, as much as possible within the limits of the funds available. You know that there are so many things that are competing with the funds available. But I'm saying that to all intents and purposes, this present administration is giving a lot of attention to the health sector. In the history of this country, this is the first administration that was able to make what we call the Basic Healthcare Provision Fund, which is 1% of the consolidated revenue fund, available to the health sector. Of course, this is what we have under the National Health Act. So, no other administration has been able to make that that money available, which is meant to increase the funding to the health sector, because that's a basic thing that this administration is conscious of and working towards. At least we need to increase the funds available. And at the moment, the funding of the health sector is not what it should be. So I'm saying that the administration is making efforts to increase that funding. And of course, the NHIS is there, National Health Insurance Service, which this present administration again is now trying to make compulsory as opposed to optional status of the NHIS that existed prior to now. So when we have more funding in the health sector, then we'll be able to achieve more. And that will also translate to giving greater attention in terms of welfare of the health workers generally, not just doctors, nurses, pharmacists, the medical laboratory scientists, name everybody that is it. Don't forget, the healthcare is a team. So, and every member of that team is important in running the entire system and being able to give health care to our people. So every effort is being made in that regard in terms of enhancing the welfare of health workers as a sector. Of course, the issue of
So, sir, thank you so much for that, sir. Obviously, you have called to our attention that there's a problem with budget deficits in the sector of the health, in the health sector, which are the challenges that we have witnessed thus far. But I can't help but ask, sir, as the Minister of State for Health, what are the landmark achievements that the healthcare system in Nigeria has witnessed since your assumption of office?
Well, probably the most outstanding is that Nigeria exited the unenviable group of the 3 countries that still harboring the wild polio virus.
Okay.
You know that we exited that group.
Yes.
The group where you have Pakistan, you have Nigeria, and then you have Afghanistan. So we were certified polio free last June or July thereabout. So that is a major achievement which we must celebrate, because so many people, so many groups, so many international organizations, development partners have really put in a lot to assist us in achieving that feat, so to speak. So that's a major one.
Well done, sir.
Yes.
Yeah, go ahead, sir.
Hello?
Yes, sir. So on a lighter note, sir, we're quite cognizant of the recent happenings in Nigeria and the youth being at the center of discussion in these times. So being an elder statesman and a respected citizen of this country with integrity, I must emphasize on, what advice can you give to the youth on our show today?
Oh, well, let me say that our youth, they have so much to offer this country, because there's what we call the youth board. That is, in terms of when you plot the graph, the population graph, you will see that we have a very high percentage of youth who are so productive, in their engagement in various ways, whether it's in entertainment, whether it's in sport, whether it's in ICT, name it. So, my advice is for them to, when it comes to expressing themselves, they need to be more, be more articulate and be willing to come forward and engage at every point in time. At no time will any government believe that it has all the answers. So we need to work together. So they should always be willing and ready to dialogue with government on issues, particularly in issues that affect them primarily. And there's no way that government can do it alone, but that they should always be willing to dialogue and ready to, come to a round table for discussion on issues that affect all of us, and particularly the youth in particular.
All right. Thank you, Honorable Minister, for those submission. You have cleared most of our doubts about the vaccine. Again, our closing remarks, courtesy of Moluabi personality from Goldberg, is a healthy nation is a wealthy nation. A healthy nation is a wealthy nation. We can't be any better or become more productive as a nation without the good health and the positive state of mind. It is our duty, just like as our Honorable Minister have emphasized, that we should stay safe, adhere to safety guidelines for the pandemic till we get the vaccine our way. Again, till I come your way next week, this is where I draw the line of the curtains of today's show. My name remains Kike Lomatanda, and you have been on Real Talk with Kike. Bye now. Thank you so much, Honorable.
Thank you very much for inviting me, and it's a pleasure to be part of this.
All right. Thank you, sir.